Hi, I'm Dr. Kim Evans. Welcome to my YouTube channel. Today, we are going to be talking about what to expect at your first visit with a surgeon after a diagnosis of breast cancer. The first and most important part of the visit is getting to know your surgeon. You want to make sure that you trust them and that you are comfortable with them. After a diagnosis of breast cancer, most surgeons will follow their patients over the next 5 years to ensure that there are no signs of recurrence. If at all possible, I recommend having someone go to the visit with you. They can take notes and they can be your advocate during your visit and throughout your treatment. We discuss so many things during the first appointment. It can be extremely helpful to have a second set of eyes and ears at this visit. During this first visit, your doctor will go over your history as well as any workup and imaging you've had prior to your visit. It's important that you are open and honest so they can get to know you and to ensure that you get through the perioperative period as smoothly as possible. Next, they will perform a physical exam, focusing on your lymph nodes in the neck, above the clavicles, and in your armpits, as well as examining your breasts. After the exam, they will discuss important information about your specific cancer. The two main types of breast cancer are lobular and ductal. They will discuss which type you have, as well as whether or not you have in situ cancer or invasive carcinoma. They will address the size. They will also go over the grade, hormone status, HER2/neu status, and Ki-67 or replication rate of your tumor. Additionally, they will go over the importance of a multidisciplinary approach to cancer and the early involvement of radiation oncology and medical oncology. Now, we're going to get into some specifics. Tumor grade ranges from 1 to 3. Grade 1 tumors tend to be less aggressive than grade 3 tumors. Next, we're going to look at the hormone status. This regards whether or not your tumor expresses estrogen or progesterone receptors. When positive, we can prevent recurrence by either blocking estrogen or blocking the conversion of E2 to E3 estrogen in postmenopausal women. HER2/neu is a proto-oncogene. This means that when it's turned on, it can increase replication of cancer cells. We now have targeted medication for the HER2/neu receptor. If your tumor is positive for HER2/neu, your team will discuss the specific treatment. Medical treatment for cancer, including hormone-blocking medication and targeted therapy for HER2/neu, as well as potential chemotherapy, is usually managed by a medical oncologist. Having them on board early can help you understand the other stages of your treatment. In addition to discussing your cancer biology, your surgeon may recommend genetic testing to determine if you are at increased risk of cancer recurrence or increased risk of a secondary cancer in the other breast. They may also recommend preoperative testing and potentially additional imaging. When it comes to surgical treatment of breast cancer, the options include lumpectomy, usually followed by radiation, and mastectomy. You will also discuss the option of breast reconstruction. As long as you're a candidate for both operations, long-term outcomes in terms of local recurrence and long-term survival are nearly identical when you compare lumpectomy with radiation to mastectomy. The choice of surgical approach is a very personal one. I recommend that you spend time with your surgeon and make sure you understand the risks and benefits of both approaches. Regardless of the type of operation you and your team choose, a lymph node biopsy will be recommended at the time of your surgery in conjunction with treatment of the breast if you have an invasive carcinoma. When possible, a sentinel lymph node biopsy is performed. With a sentinel lymph node biopsy, we are sampling what I describe as the catcher's mitt of lymph nodes. If cancer leaves the breast, it almost always goes to this catcher's mitt first. At the end of your visit, your surgeon will likely summarize the discussion held, surgical options, and next steps. Remember to take notes and ask any questions that you have. You will likely have a follow-up visit to discuss results from preoperative testing ordered during the first visit, as well as to solidify your surgical choice. I hope that this video was helpful. If you would like to learn more, please subscribe. There will be additional videos detailing the topics that were introduced during this one.